Welcome back to KUTV Primetime News. We begin on a light note where the month of November is owned by certain individuals who are men who do not shave their beards for the entire month of November. But November also has other things that we commemorate, and one of them is diabetes. And we're here to talk about diabetes. You've had it in the streets, you've had it probably around your friends and relatives, and we're here to once again delve deep and see how exactly we can be able to make sure that less and less people in our community are contracting this particular kind of lifestyle disease. And a few key facts from the World Health Organization: the number of people with diabetes rose from 108 million in 1980 to 422 million. That is from 108 to 422 million in 2014. All right, then prevalence has been rising more rapidly in low and medium income countries. Diabetes is a major cause of blindness, kidney failure, heart attack, and lower limb amputation. Another key fact: between 2000 and 2019, there was a 3% increase in diabetes mortality rates by age. Now, in 2019, diabetes and kidney disease due to diabetes caused an estimated 2 million deaths. On a brighter side, a healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco, these are ways to prevent and delay the onset of type 2 diabetes. Diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication, and regular screening and treatment for complications. Remember, last week we talked about type 1 diabetes and type 2 diabetes. And in case you missed this particular conversation, KUTV News Kenya on YouTube is a place for you to go get that particular conversation and see how we scratched the surface last week. Today, we have gone beyond the surface and we are talking about deeper matters. And joining me once again this week, for the second time this month, Justar Kajuju, founder of Diehope Kenya, is here with us to help us understand more about diabetes. Karibu sana, Kajuju.
Thank you very much.
Yes. All right. So just before we go very far,
Yes.
For the sake of those joining us in this particular day as we talk about diabetes, what is the day, or what is a day in the life of a diabetic?
Well, I would say basically we have two types of diabetes, and type 1 is the one that is more challenging because it involves the taking of insulin injections. So basically you have to monitor your blood sugars and you have to take injections before meals and sometimes after meals. So basically you have to be so keen on, diets, exercise, and generally everything. So in terms of, what you spend per day, it is so much, and that makes it a very expensive disease to manage. And even the care, which includes mental health, it includes diet or nutrition, and medication is not just simple, disease. So I would say for instance, for a normal, Kenyan person, a common mwananchi, who doesn't have insurance, when it comes to medication, it is expensive. Also, people living with disabilities, it is an expensive, because for instance, a doctor is not taught how to, communicate with sign language and that. So we have things like hypoglycemia and hyperglycemia. So when such things happen,
and what are those?
Hyperglycemia, it is when your sugars levels are high, and hypo, it is when they are down, which is very risky because the signs are you can even go to a coma, you know. So it is a disease that requires a lot of care, you know, and management. Yeah.
And your passion against this disease has caused you to really be out there to fight. You have a new initiative called Beat Diabetes.
Yes.
I want us to spare a few minutes, talk about that. What is this all about?
Well, my passion for this came in when I went to present, I won't say that again, a research in Abu Dhabi. I never thought I would be in this field of, you know, diabetes. But I don't want to call it, you know, experience, because it is not a thing to, you know, be proud of. But if you are in a situation, you need, you know, to try and understand and also take care of yourself, because if you don't take care of yourself, definitely you're going to die. So when I went there and I presented and I met other, you know, people, young people living with diabetes, and I saw what they were doing, and you know, they were ambassadors for diabetes, you know, they would, you know, I saw good things that they were doing, and that motivated me. So I had to come back and, you know, use my voice, because if you're given a platform and you don't make a difference or a change, then I don't think that is a wise thing. So I came back and, you know, a few friends that I had in school living with diabetes, trying to talk to them at least to open up, and, you know, we became so close. We started even doing events, you know, sharing experiences, you know. So that motivated me. And since I was in that, you know, situation where I didn't have people to talk about, you know, about diabetes too, so I thought, yes, this thing can be, you know, a nice initiative. And then talking about policies and education still, you know, for advocacy, it is just that, you know, you can have different types of advocacy, but, you know, your main or your major goal is the same, making, you know, people living with diabetes have the education, then other people, you know, people that are not living with the condition understand and support, you know, us that are living with the condition, and not to talk inside the, you know, doctor space, but also talking about diabetes openly. Yeah, and that will end stigma.
All right.
Yeah.
Just before we go very far, Beat Diabetes is happening tomorrow, 25th of November, from 2 p.m. Where is it happening?
At Kahawa Sukari.
At Kahawa Sukari.
Yeah. Partners for Care. There's us. Yeah.
All right. Just before we go very far also, let's talk about the issue of people coming to your event. People are going to come to your event, definitely.
Yes.
As the vision bearer, you must be in a position where you can see, you can more of see the end from the beginning.
Yes.
Of course, as a dream. What people are going to come to your event, how do you want them to go home feeling like? What do you want them to do after they go home? What are those action points that someone comes out of your event, they're like, I must do this? What are those things?
Well, at first when I started this initiative, I started it like a year ago, but I wasn't confident enough to, you know, share it with my friends that are not living with the condition. So when I opened up to some, and they were really embracing the idea that, yes, you should do this, you know, my parents have the same thing, but it's like they don't even want to share with anyone. It's like people in the office, they have that othering thing, you know. So I just tend to explain to them, like, yes, it is a condition that is manageable. If you manage it and you have the required, you know, medication and support, then you can, you know, live freely. And they supported me and told me, you can do something. Yes, we'll support you. that is why, I had to take that bold step of coming out and, talking about it boldly, because now at least I have, I've seen that people are embracing it. And now, tomorrow, I'm pre-launching it, and I'm inviting my friends. Actually, they have really supported me, as you've seen, by buying a t-shirt, so that we can come up with that hypo kit. Hypo kit, diabetes hypo kit, it consists of sweeteners. So when your sugars are down, that is the first step. I'm supposed to, educate people that don't live with that condition. If a person passes out and he has that, there will be a card written I'm diabetic. They can give that person first thing something sweet, so that it can raise the blood sugar or normalize the blood sugar. The second thing is it will have a glucometer. That is the machine that is used to test RBS or blood sugar, and then it also will have some, red lights, how you will know this person has hypo, and all that, and what to do. So that is why I'm doing that, so that people can support, and they are really supporting, and I'm happy, and I'm so grateful for that, and I'm humbled because people are embracing it, because it's not a very cheap, to come up with all that kit is expensive.
All right, and talking about kit, as I asked you this question, we can start preparing your elements. She had requested to show us a bit of something practically here on this particular set. So I believe my director will be helping me with that as well. But before we go there, you've mentioned community, and in terms of the community that you have right now, you're very proud of your community, who are your friends, and in the cases of other initiatives like crowdfunding and the like, family and friends come in first, and you seem to have support from your friends who have bought the t-shirts, are going to show up, help you do the work, and of course I would assume that you're building tomorrow is a day of you building a bigger army to be able to create awareness, because awareness has to survive on the fact that you can create an army to push the agenda. What kind of day are you looking at tomorrow? Will there be fun activities? Is it going to be a lecture? Is it going to be a walk? What are we expecting tomorrow?
Actually, I end up working on 14 in KU. We had partnered with KU, Kenyatta University, and other universities around, and other people. So we had a walk on 14, then we did a challenge called Blue Balloon Challenge, because as a Diehope voice, we had that common activity that we were doing with other diabetes voices the whole world. So for tomorrow we'll just have the same thing, and then I will have a team of medical professionals. Personally, I'm not a medical professional, but I'm a diabetes educator. Sorry.
No.
And so tomorrow I'm looking forward to telling people what is this I'm doing, because now I've been doing it with my group, the sweet group, and young people living with this condition. So tomorrow I'll explain to them what is like I'll do now, what is an hypo kit, and still I will be showcasing what it entails to mean diabetes awareness, and what is that diabetes education. It's not just the education that we get from school, it's something different.
Definitely.
And still talking about stigma, and then the support, and my vision, and my mission, all that. There is a lot of things to be learned, and as we start this journey, because that is my first step.
Wow.
Yeah.
That's her first step, and I must say it's a pretty big step, and we acknowledge and appreciate and applaud her in this particular move. I just want you to remember that word has it out there of course, that word that is not true, that diabetes is the disease of the aged, not anymore. Young people are getting this particular diabetes, and that's why we have to beat diabetes. So when you hear the likes of Diehope and Diehope Voices, these are some of the sites and pages and organizations you need to look up and seek guidance in case you need help. So be sure to talk to Justar at Diehope Africa, right?
Yeah.
Diehope Africa and Diehope Voices. It's about that time. You need now to show us those things that will help us understand much more about this. So if you don't mind, you can just go ahead.
Okay, so if you see me with a purse, it's not just a purse having money or no, it's a purse having a lot of things, which include, this is a machine, this is called
you can show them
this
on
is
the
called a glucometer. And then we have these at the strips, testing strips. And then we have the insulin. This is the insulin. This, for me, I have to take this for three times a day. And then this is now this one, we use it to prick our fingers every time, because I need to check my sugars like 3 times a day before I take a meal, after I take a meal, maybe if I end an hypo. So if you look at my fingers, you will see.
Just allow me to interrupt. Why are you pricking your finger? And
to test my blood, my sugars. Because sometimes they can be so, and then other times they can go down to hypos. And then you see, you use these things to sanitize your body when you're injecting or when you're pricking your fingers to test. And then we have something like this. This is the one now you use here.
All right.
So this is the one, the injection. Yeah, it is called a twist.
Is it the insulin injection?
Yeah, this is the insulin.
Okay.
So this is expensive. There are others that are called vial, but now you can't walk out with it for some time without putting it somewhere. And that hypo kit that I'm preparing, it will have, a place that you can keep it maybe for a day when you're traveling, if you're a student, if you don't have a refrigerator, you don't have to use, contaminated things. Yeah. So that's it. And now the sweetener, I didn't manage to come with the sweetener.
No worries.
Because I have an hypo in the car. So these are expensive. Everything here is expensive. Even this is money. So when you open here, there is a lancet that now you use to prick. It's also, it goes for around 30 shillings. This one goes for around 30. This one, everything is expensive. So you see, why there is high mortality rate for people living with diabetes, it is because of how the condition is very high to manage, and we've not even brought in nutrition and therapy and all that. And so that's why I'm pushing on this, and still as I push on this, also I'll push on price cap, because we have so many pharmaceuticals, companies, and they have different things. So for instance, today I'll have this, next day I'll have a different type of it. So if you go to the market, you've bought this, let's say for around $35, that is 3,800 or 4,000, 5,000. When you go back to the pharmacy, you won't get the same thing. So it is expensive, and that makes now the rise of DKA. DKA is when you cannot manage sugars, or your sugars are very high, and then other diseases, opportunist
diseases.
Yes. So they attack you, and then you become weak, and that's why you see things like kidney failure and amputation, because people are not managing it well. So there is a very need for diabetes advocacy, not only in Kenya but in Africa. Because other countries, developed countries are doing it well to a point that they can even provide, medication for everybody. So have a question, like, you know, a student here in Kenyatta University or in another university or even a young person, and how like the economy is. Just imagine, how are they how do they get all these people? And we don't get them free from, you know, from the hospitals. So we also need to the government need to come up with proper policies that will look into these things. And you know, without the noise, they won't be able to understand that there is a need.
All right.
That's why people like Diehope are coming up.
All right.
Yeah.
And we hope you do a fantastic job tomorrow.
I will definitely.
We take time, of course, on behalf of KUTV fraternity. I want just to wish you well.
Thank you.
And successful day tomorrow as you continue to champion for the diabetics and against diabetes, even affecting more people. Thank you so much for joining us. Unfortunately, we are out of time.
Okay.
But thank you so much for coming and shedding more light.
Thank you.
We wish you the very best.
Thank you very much. And actually, this is my time. I need that time might have shown me that I need to eject myself. So this is a way of awareness. If allowed, I can eject myself.
You want to inject yourself?
Yes. Because people should not hide that.
All right. Let's have that. I think.
1 second.
Right.
It is okay. I'll just need this is a sanitizer. Then I'll sanitize my body. Then I'll use a new ejection.
All right.
I'm done. It's just 1 minute. You know, we want to end the stigma. And then you just measure how many. I take 12. So I'll just eject myself. And that's how we end the stigma.
Wow.
And I'm done.
Wow.
But now we want to push these that we can be able to get it, because if I wasn't able to buy, then I wouldn't be here.
Thank you so much.
So I want people to support us. We can't live without this.
Thank you so much.
Thank you for giving me this opportunity.
Thank you so much. I can feel the passion. The passion is filling this room. Thank you so much. This is where we come to an end of this particular conversation for now. Diabetes Israel is here with us. We have to beat diabetes. We take a short break. We'll be right back with more.